Hi, the title of my editorial this month is The Philanthropic Ophthalmologist, and it's a look at the contribution that ophthalmologists make to help their less well-off fellow human beings. But I start off by describing just how well-off ophthalmologists are. According to the recent Medscape Physician Lifestyle Report, out of 26 medical specialists, ophthalmologists figure among the healthiest, the wealthiest and the happiest, and they actually rank highest overall in terms of lifestyle satisfaction. One way of generating personal happiness and lifestyle satisfaction is to help others, and while this wasn't assessed in the lifestyle report, I'd imagine that ophthalmologists would have excelled in this category too. For physicians in general, the impact and reward of philanthropy is very high, and this kind of reaches its peak with ophthalmologists, and that's in part because 9 out of 10 people who are visually impaired live in developing countries, and in 8 out of those 10 cases the visual impairment could be avoided or cured. I think this helps explain why so many ophthalmologists spend a good part of their vacations in developing countries removing cataracts and performing other surgical procedures in an almost production line format. These travelling ophthalmologists can each day have transformational impacts on the lives of numerous patients in these countries, and that's really a great humanitarian gift. It's a gift that's the result, of course, of many years of training and hard work on the part of doctors and surgeons, and a huge amount of fundraising and hard work on the part of organisations like Sightsavers and the Fred Hollows Foundation that fund the surgeons to go on these trips. This is a topic that I'm intending to come back to in future issues of The Ophthalmologist. But what really prompted me to write about this in the editorial was an interaction that I'd had with a gentleman called G.N. Rao, who recounts a narrative about building the L.V. Prasad Eye Institute in Hyderabad in India. That's the feature in this month's issue. The Institute has brought the highest standards of eye care to city residents as well as to country dwellers in a major state in India, and more than half of the patients that are treated are given treatment free of charge. Rao, in effect, is a model philanthropist, and he's also a very happy chap to boot. I encourage you all to read his story. I think it's very inspiring.